Hi everyone, I am Dr. Jay Govinda Ukkinadka from Ukkinadka's Ayurveda. Today let us know about the osteoarthritis and its management in both the contemporary science as well as in Ayurveda. So osteoarthritis is one of the most common problem suffered by the middle-aged group as well as the elderly. Especially in elderly, it is almost common in majority of the population. And osteoarthritis is the condition where the joint gets eroded. Here in the joint, initially it will be cartilage. Once the depth of the cartilage, when it is covered, then it will cover the bone also. So this erosion, even it also involves the pain in the surrounding muscles, pain in the ligaments. So the osteoarthritis pain is not just a pain of that particular joint, and the pain also involves the different aspects of its surrounding structures and other structures of the joint. The majority of the joint suffered is the knee joint, the weight-bearing joint, and also hip joint. Even in the ankle it can happen, and low back, lumbar spondylosis, cervical spondylosis. These are the common areas, but the commonest and the most common is the knee joint, and it can the second may be in the hip joint. So this osteoarthritis, the process of osteoarthritis, it starts to occur in almost each and every individual from the age of 25. And it doesn't mean that a small amount of erosion will cause pain. And one cannot avoid this process of this wear and tear happening in our body. But there are so many factors. Some are preventable and some are non-preventable. There are so many factors which influences the occurrence of this osteoarthritis. In many families, we might have seen, we usually see that even after 70, they don't suffer from osteoarthritis. In many people, some people in a family, many people may be having this osteoarthritis. One or two may not suffer from osteoarthritis even after 70, like that. The pain due to osteoarthritis. And there are so many factors which influences the which precipitates the process of this bone erosion. And let us see which are the major influencing factors. One is the age. As we age, yes, definitely there will be degenerative changes in the body. This erosion is nothing but the wear and tear. It is a form of degeneration only. So as we age, we become more prone to develop this osteoarthritis, because the body, the nature of the body, the elasticity in the tissues, muscles, even in the cartilaginous tissues, everywhere it comes down. The amount of blood supply, there will be variation. So as we age, naturally we suffer from this, the tendency of suffering from this osteoarthritis becomes more and more. Next one is the obesity. Obesity is another most common cause for the osteoarthritis to occur. And even, as I told earlier, many people in the same family may suffer from this osteoarthritis in early age. Even the genetics plays major role. And they have identified so many gene factors, isotopes, which causes this osteoarthritis to occur very soon or in an early age. And then is the reduced level of sex hormones. So if we consider these as the major 4 causes, like it may be age, obesity, or it may be genetical cause or reduced sex hormones. So these 4 is mainly dependent on, one is the sex hormone is also dependent on the gene as well as our lifestyle. And age, we can delay the aging by so many means. Like, see, in Ayurveda, in Charaka Samhita, the first two chapters in Chikitsa Sthana is Rasayana Dhyaya and Vajikarana Dhyaya. Then let us see what is Rasayana and what is Vajikarana. See, the sloka says like this: Swastasya urjaskaram yattu, swastasya urjaskaram yattu, tadvrushyam tadrasayanam. Praya prayena roganam dvitviyam prashamematam, praya shabdavisheshartha vibhayam vibhayartha krit. So the first two chapters explained by Charaka in Charaka Samhita is one. The first chapter is Rasayana Pada, explained in other sub 4 groups, 4 padas, and even Vajikarana Dhyaya explained in another 4 groups, 4 padas. So Rasayana means one increases, which is Urjaskara, or which increases the Oja in the body, or which delays the aging process in the body. So you might have heard about Chavanaprasha. That is one of the Rasayana. A very well prepared, or a well prepared Chavanaprasha as per the classical text serves very good function of this Rasayana. That means delaying the aging process. So also it improves the Urjaskara, that means Oja, improves the immunity in the body. And Tadvrishyam Tadrasayanam, almost all Rasayana Dravyas are also Vrishyas. But the speciality of Rasayana Dravya, in text, whatever Rasayana Dravya is explained, another speciality of the Rasayana Dravya is those Rasayana Dravyas are having curing so many diseases. They can be used in a therapeutic use also in curing so many illnesses. And Vrishya is mainly to improve the sexual ability of male here. Mainly, this Vajikarana is explained for males. But if you consider, or if you want to delay the this process of degenerative changes or the wear and tear in the joint, one should follow the Rasayana and Vajikarana for both male and female. Vajikarana in the sense here, increasing or maintaining the optimum level of sex hormones in males as well as in females. So our ancients, they knew that these two are the important aspect of life to delay the aging process, to delay the degenerative changes in the body. The aging happens mainly because of these accumulation of toxins, then aging process and enhancing of aging process, and even the reduced level of the sex hormones, even that accelerates the aging process. So, as explained in Ayurveda, the first 2 chapters, each and every individual should give utmost importance to Rasayana and Vajikarana. Rasayana is the process of delaying the aging process in the body, as well as Vajikarana, maintaining the optimum level of sex hormones in the body, not only to maintain the libido or to perform the sexual intercourse properly. This Vajikarana should be done even to delay the aging process or the degenerative changes in the body. So, these two, when a person follows these two, almost 50% is done. So, next, the other parts, anyhow, the trauma, muscle weakness, then repetitive use, like in sports people, you might have seen some of the fast bowlers like Kapil Dev. He suffered from knee injury in a very early age because of his too much use of the joint. While they bowl, they put so much of pressure to their knee joint. So repetitive pressure that causes early wear and tear. So that kind of overuse can also cause this early osteoarthritis, even infection. Many do suffer from infection, infective tuberculosis or some bacterial infection. So many things that can happen in the joint even after treating it successfully may end up in early wear and tear because of the damage. And even diseases like gout, the crystal deposition, calcium crystal deposition in some patients, and even diseases like rheumatism, rheumatoid arthritis, ankylosing spondylitis, etc., in which these inflammatory diseases, even post-chikungunya, many have suffered from osteoarthritis, even post-chikungunya. That inflammation causes damage to the joint. Secondary to that, even if we successfully manage these conditions, the secondary osteoarthritis may remain. So whatever damage has happened can cause secondary osteoarthritis in the weight-bearing joints or in the joints which have suffered a lot. And even some diseases of the bone like Paget's disease, avascular necrosis, many people will have reduced blood supply. Mainly it happens mainly in the hip joint. It is a ball and socket joint. So when there is scarcity of blood supply to this ball in the femur, in the thigh bone, so such people can suffer from osteoarthritis of the hip. The overuse of these steroids, fall in the early age, and some overuse of drugs, even injury and congenital anomalies can cause this avascular necrosis, that is mainly in the hip joint. So there are even uncontrolled diabetes. So there are so many conditions which may end up in osteoarthritis. Even some surgical procedures like surgery for the meniscal injury. Even if one goes for surgery, some damage, whatever is retained there, can cause early wear and tear. So this osteoarthritis is mainly because of the wear and tear. So as we discussed, there are mainly 3-4 basic conditions which precipitate this: age, then trauma, then obesity, then nutrition part, even genetics, then reduced level of sex hormones. All these can be maintained very well with the Rasayana and Vajikarana Chikitsa. How it is performed? To give Rasayana, we have to perform Panchakarma Chikitsa at first. See, if one follows this Rasayana Chikitsa very strictly, one should be administered with Shodhana Chikitsa. That means the cleansing or removing the toxins from the body. See, another major cause for this early aging is accumulation of toxins in the cells. Like one suffers from Alzheimer's because of neurotoxins accumulating in the neurons. Even Parkinson's disease, the role of these neurotoxins is very high. So many illnesses are caused by this accumulation of toxins. And when one suffers from illness, even that will enhance the aging process. Even this accumulation of toxins in the cells causes early aging. Even accumulation of free radicals, where we exercise, we do work. So whenever we do work, there will be production of free radicals in the body. Whatever food we take, like fruits, vegetables, then so many minerals like zinc and all, which are antioxidant in nature, they will bring down the amount of these free radicals in the body. But still, following this Panchakarma will help a lot in eliminating the toxins forcefully from the body. So, Charaka explains it beautifully. In a dam, after a few years, there will be accumulation of this mud. So, if you don't clean it regularly, the purpose of the dam is to have a reservoir of water. It is a reservoir of water to accumulate more and more water. So the purpose we cannot serve if proper cleaning, like periodic cleaning is not done. The same way, even in the human body, there will be accumulation of these toxins. Though we have a system in our body to eliminate these toxins, it cannot be done fully. So to forcefully to eradicate it, we have to go for Panchakarma, and post Panchakarma, it is very good to follow the Rasayana and Vajikarana Chikitsa. And other than this Rasayana and Vajikarana, what happens after one develops pain? There will be pain, there will be inflammation in the body, there will be muscle pain, there will be tendinitis, there will be a pain in the surrounding area. So even there may be the health of the bone may not be good. So all these, other than Rasayana and Vajikarana, we have to thought of, and the appropriate treatment can be given even with Ayurveda for all these. Not even with Ayurveda, we can give it in a much better way than the contemporary science. Like we can prescribe Vedana Stapaka Dravyas, Vedanahara Dravyas, Ayurvedic Vedanahara, in the sense some herbal medicines which are totally safe, devoid of any side effects. We can use it for longer duration without any side effects. And in anti-inflammatory, there are so many drugs which are anti-inflammatory as well as Vedanahara. So usually such drugs we prefer in advanced osteoarthritis. Even in when there is moderate damage, such drugs are of more value. It brings down the pain, symptoms, everything very fast. And along with that, if you perform the Panchakarma followed by Rasayana and Vajikarana, it will prevent the aging process. It will check the speedy enhancement of aging process. Anyhow, we can't stop it. We can only slow down the aging. And even maintaining the sex hormone level will help a lot in retaining the libido in the body. And that libido is also one of the important factor in protecting the health of the bone, preventing the degenerative diseases and all. So in Ayurveda, mainly we do suggest Panchakarma followed by Rasayana and Vajikarana, and also we prescribe the medicines which can reduce the pain, which can reduce the inflammation, which can also bring a cartilaginous cover, like which can cause some regeneration in the joint, so that it will help in improving the cushion effect to the joint to bring down the pain. And also from externally we can usually advise to apply oil, some of the gels or some applications. And also we at Kinadaka's Ayurveda, we also suggest to go for Marma treatment. Marma treatment, because this Marma treatment helps mainly in the tendinitis, tenosynovitis and all, which is these tendinitis and muscle pain is very common in osteoarthritis, almost in all osteoarthritis. And I have seen many osteoarthritis patients, when we treat this tendinitis and these muscle pains, their 90% of the pain comes down. And in such patients, using of these herbs along with these measures, that gives tremendous results.